How does a DEXA scan diagnose osteoporosis? Have you ever wondered how doctors can tell if someone has osteoporosis? One of the most effective tools they use is a DEXA scan, which stands for Dual Energy X-ray Absorptiometry. This scan is designed to measure bone mineral density, or BMD, which is crucial for diagnosing osteoporosis. During a DEXA scan, two low-dose X-ray beams pass through the bones and soft tissues. The scan calculates how much of the X-ray energy is absorbed by the bones compared to the surrounding soft tissue. This process produces a precise measurement of bone density. The lower the bone density, the weaker the bones are, which increases the risk of fractures, a key characteristic of osteoporosis. Typically, the DEXA scan focuses on the lumbar spine and hip, as these areas are common sites for osteoporotic fractures. The procedure itself is quick, painless, and non-invasive, usually taking about 10 minutes. Importantly, the amount of radiation exposure is very low, much less than what you would receive from a standard chest X-ray. Once the scan is complete, the results are expressed as T-scores. These scores compare the patient's bone density to that of a healthy young adult reference population. According to established medical guidelines, a T-score of -1.0 or above is considered normal bone density. If the T-score falls between -1.0 and -2.5, it indicates low bone mass, also known as osteopenia, which is a precursor to osteoporosis. A T-score of -2.5 or lower confirms a diagnosis of osteoporosis. Severe osteoporosis is diagnosed when the T-score is -2.5 or lower and there is at least one fragility fracture. These thresholds are standardized by the World Health Organization and are widely used in clinical practice to guide diagnosis and treatment decisions. In addition to diagnosing osteoporosis, DEXA scans are valuable for assessing fracture risk. They combine bone density results with other clinical risk factors, such as age, sex, family history, previous fractures, smoking, and alcohol use. This comprehensive assessment helps healthcare providers create personalized management plans aimed at reducing fracture risk. Osteoporosis often develops silently, meaning many people do not experience symptoms until a fracture occurs. This is why DEXA scanning is crucial for early detection, especially for postmenopausal women and others at increased risk. Furthermore, DEXA scans allow healthcare providers to monitor the effectiveness of osteoporosis treatments over time. In summary, a DEXA scan diagnoses osteoporosis by quantitatively measuring bone mineral density with low-dose X-rays. The results are interpreted using standardized T-score thresholds, and clinical risk factors are integrated to evaluate fracture risk and guide patient care. If you have concerns about osteoporosis, it is always best to consult with a healthcare professional for personalized advice and recommendations.